Hi students, welcome to Chapter 5, Learners with Intellectual and Developmental Disabilities. I think this will be an interesting chapter for you. Many of you will not be dealing with students that have intellectual and developmental disabilities, but I think understanding this category gives you a fuller understanding of the spectrum of services that are provided in the learning disabilities area. So we'll go ahead and get started. We don't have any vocabulary words for this particular chapter, but we'll start off with our misconceptions, and you can go ahead and read those on your own. The answers are in the next couple slides, but the first one is professionals are generally in agreement about the definition of intellectual disabilities. True or false? Once diagnosed as intellectual disabled, some can improve to the point where they are not intellectually disabled. That's an interesting question. In other words, can you grow out or can you learn out of being intellectual, of having an intellectual disability? And when you think of somebody with an intellectual disability, think of a student that perhaps is a Down's syndrome student. So that gives you kind of an idea where they might fall on the spectrum. Intellectual disability is defined by how a person scores on an IQ. So if we take a look at the answers for those three questions, whether or not there's agreement on the definition of intellectual disabilities, there's much disagreement in terms of what the classification are, or what the classification is for intellectually disabled. Once diagnosed as intellectually disabled, can someone improve so they're not intellectually disabled? And the answer to that is true or yes. So with the proper support, at school, proper support at home, there can be some improvement, and some students can grow out or learn out of that label of intellectually disabled. Intellectual disability is defined by how a person scores on an IQ test. Well, there's two, the answer is false, but there's two criteria for intellectually disabled. And one is the low intellectual functioning, in other words, a low IQ, and usually below 70 is what we're talking about, and low adaptive skills, or inability to be able to socialize, inability to be able to do some of the basic tasks that life requires of us. So you have to have both of those criteria to be classified as intellectually disabled. So let's go on to 4, 5, 6, and 7. The mapping of the human genome makes it easy to identify the cause of intellectual disability. True or false? Number 5, it's still difficult to determine how much a person's intelligence is due by heredity versus the environment. Number 6, the teaching of vocational skills to students with intellectual disabilities is best reserved for secondary school students and beyond. And the last one, people who are intellectually disabled should not be expected to work in competitive employment. True or false? So if we take a look at the answers, number 4, regarding the human genome, the studies of the human genome have been very, very helpful, and they have helped to identify causation related to intellectual disability, but there are still many causes for someone being intellectually disabled, and what we'll do in this chapter is we'll talk about some of those causes. It's difficult to determine how much a person's intelligence is determined by heredity versus environment. That's true. It's very difficult to separate those two, although sometimes you can attribute intellectual disability to the environment and to heredity. It's not always a clear-cut picture, and often than not, it's a combination of both influences. The teaching of vocational skills to students is best reserved for secondary. False. Experts believe that it's really good to begin working on vocational goals, vision that students might have for their vocation as early as elementary school. And the last one is people who are intellectually disabled should not be expected to work in competitive or in employment. And that's false. With the proper support, again, home and school, with job coaches, many intellectual students with intellectual disabilities can work in a competitive job market. And we'll talk about that in the coming chapter. So this is, you've heard of Down syndrome. Well, this clip is called Up syndrome, and I'm going to ask you not to watch this right now because I would like to share this with you in class, and we'll talk about it. But it's a very interesting clip. I think you'll enjoy it, about Renee. So as we do in each chapter, we talk about the definition of the disability, and so in 2007. January 2007, the American Association of Mental Retarded was changed. This is the association that works with students with intellectual disabilities, which changed to American Association on Intellectual and Developmental Disabilities. So the word retarded, which still is used in an off-colored way today, but I remember growing up, that's the way that students with Down syndrome, that's how they were classified. They were classified through the word retarded. Now, again, 2007 wasn't very long ago, but that term has changed, and most people probably still relate to the term mentally retarded. Most people probably don't know what intellectual and developmental disabilities refers to. But hopefully with education and as the years go by, this change from retarded to intellectual disabilities, developmental disabilities, will be more accepted. So I think the question I have is pretty apparent, is why do you think they made that change in 2007? So there's a little site here that can connect to the American Association of Intellectual Developmental Disabilities. So you can go on this site, maybe just take a few minutes and check out some of the links, and use this as a resource for better understanding this particular category. So as in all definitions, there's usually a history behind it. If we look at the history in terms of intellectual disabilities, there's many terms that were used to describe students. We talked about one, the idea of retarded. I remember my great uncle was in the Civil War. The story was that he was shot in the head and survived, but that wound did something to him mentally. And I remember reading, we have somewhere in our family Bible, we have his death notice. He died in the early 1900s, and it described him as an imbecile, which is the second category there, which means someone who has trouble thinking. He was probably, that wound probably affected his ability to interact with other people. Probably intellectually had a low IQ because of the wound. Idiot was also used to describe someone that had severe disabilities. So you went from idiot to imbecile, which would be moderate, to moron, which was mild, and then you had the label of mentally retarded. So over the past several years, it's become difficult to designate someone as intellectually disabled. So I'd like you to take a minute. There's the monkey with scratching his chin, and I'd like you to think a little bit about, why that might be. Why is it difficult to categorize someone as having an intellectual disability? Take a minute to think about that. Feel free to turn this off or pause it. Come up with a hypothesis or an idea. All right, so here are some ideas. First of all, it's very easy to misdiagnose someone in any category for disabilities, especially if it's based on a test score or achievement test, especially if it's related to IQ. So there's oftentimes, as we talked about this in the last chapter, there's often the tendency to overdiagnose children, especially those from ethnic groups. So if we were to take a look 10, 20 years ago, those students who were classified as mentally retarded, and we took a look at the minority groups, they would have a greater percentage than, let's say, Caucasian or a white group of students. So the question is, why is that? Another reason why it's difficult to label someone is that when you label someone as mentally retarded or even with intellectual disabilities, that's a pretty, I guess the word would be severe label. There's a stigma associated, there's a perception that's associated with someone that has low intellectual functioning. We can think of Forrest Gump, we can think of Renee, and so that's another reason that there's a stigma. And if parents can figure out a way to avoid having that label placed on their child, they will do so. Makes sense. Some believe intellectual disabilities is a socially constructed condition, not as a trait within the individual. So just as we talked about last semester or last chapter, some people don't believe in inclusion. Some people don't believe that it's right to provide a label, that we shouldn't have labels, we shouldn't have categories for those who have disabilities, especially those who have intellectual disabilities. All right. So this link that you see here on this slide will put the definition of intellectual disability into perspective for you. It's short, but it's an informative link. Now, remember, keep in mind that there are some considerations that need to be made when you're classifying somebody as intellectually disabled, when you're defining them. It's based on significant limitations in intellectual functioning and adaptive behavior. So it's really important that you understand those two terms. So what is the definition of the association that works with the intellectual functioning? And so we'll go a little bit deeper in terms of the definition. First of all, it involves intellectual functioning, which is captured through the IQ plus adaptive behavior, which we've gone over. Adaptive behavior involves that social and practical intelligence. In other words, when you're out in the real world, can you relate to people? Can you solve problems? Can you interact with others in an acceptable way? So when we talk about that adaptive behavior, your ability to adapt to the environment is important. And again, intellectual functioning and adaptive behavior can be improved. You can learn out or grow out of that label. So formula is intellectual disability represents limitations in IQ plus adaptive behavior. Again, I hate to be overemphasizing that point, but it's really critical that you understand that there are really two pieces to that definition. Again, adaptive behavior is related to behavior, and adaptive behavior is also related to social intelligence. So your ability to read other people's behavior, to read their body language, to read their mood, all of those things that you do pretty much unconsciously, and you do those in a way that enables you to sort of process what's going on in a particular situation. Those with intellectual disabilities can't do that. We know that those with learning disabilities have difficulty doing that as well, but those with intellectual disabilities have a much harder time. And we also know that they lack adaptive behavior also has to do with practical intelligence. In other words, being able to navigate day to day in the real world. So those are two components, again, of adaptive behavior. So let's look at IQ, and then we look at adaptive behavior. We break adaptive behavior into social intelligence and practical intelligence. So you might want to map that out or make a conceptual map illustrating that definition of intellectual disabled. Again, we mentioned that they can be improved. How well a person functions with intellectual disabilities, whether they're in the workplace or whether they're out in the real world, really depends a lot on the type of support that they have. And support can be resources, so they can be other people that work with students in school or outside of school, or they can be strategies, instructional strategies, behavior strategies that help a student adapt, help them socialize in the real world. So one way for you to kind of assess yourself on the last several slides is to write a short paragraph sharing how the term intellectual disabilities came about and what you think defines intellectual disability. I would take just a few minutes to type that out on your computer, or just take a note card or piece of paper and sort of write about the how the label, how the definition evolved, and what you think defines intellectual disability. Okay. So a couple things that it's important to keep in mind is that there's often a mismatch between the ability of a child with intellectual disabilities and the demands of the environment. So, however, with individualized support system and with improved goals or personal outcomes, again, students can improve and maybe even grow out or learn out of that strategy. So, you know, your question might be, well, if IQ is is a component of the definition, what does that mean? You know, we talked about the fact that IQ tests aren't very reliable. There's a lot of considerations that you have to have when you begin throwing IQ numbers around. We know that the test itself poses some issues and has limitations. But generally, when we talk about IQ, someone between the IQ range of 50 to 70 is generally has mild intellectual disabilities. And I always like to kind of reference Forrest Gump, probably 65 to 70. He can communicate. He's slow in many respects. He adapts to the world in his own special way, but I would consider him probably on the upper end of that IQ spectrum for intellectual disabilities. Moderate would be 35 to 50. Oftentimes, students with Down syndrome might be in this category. Severe intellectual disabilities would be 20 to 35. I'd say Marcus might be, remember Marcus, the one that was in the boat? Marcus might be in this range. And profound would be an IQ below 20. And there's a link there that you can get on to actually, I believe it's like a scale that you can use to see where IQ would be on a curve. All right. So if you take a look at the bell curve here, and you can see the IQ scores at the bottom, 0, 55, 70, 85, 100, 115. You can see the percent of population that would have, for example, below 70. So we're looking at 2 standard deviations below the mean from 0. So we're looking at probably a 2.14% of the students are in that 55 to 70 range. And then those below 55, 0.13. So you can see that there is a small number of students that really are on both ends of the spectrum. So to the right, you've got high IQ. It's going to be probably your gifted students. In the middle, that 85 to 150 or 115 range, going to be what we would call, I guess, your normal. Again, we're not sure what normal means, but your normal students. And as we move 2 standard deviations below the mean, we get into those students with intellectual disabilities. So we can plot this on a bell curve, and we can kind of see where the percentages lie in terms of prevalence. So here's some facts. Again, 2.27% of the population has probably some type of intellectual disability. Current estimates place the prevalence of students with intellectual disabilities at 1%. So a question would be, if the normal curve, if the bell-shaped curve is saying 2.27, but the estimates are 1%, what accounts for that difference? Well, one of the things that has to take into consideration is that one is a school count, and one is probably a count based on the experts. So my question would be, is why would the actual school count of prevalence be lower than the normal count, or the count identified by experts? So think about that. Why is the school count of intellectual disabled students, the prevalence, different or lower than the what the experts say be? Now we'll go back and think about that. The answer again is that schools, if they can, will tend not to classify somebody as intellectual disability. They'll move them up into the learning disability category. We talked last chapter about why that occurs. Again, parents don't like that label on their child, and so if there's any way that they can classify their students as having learning disabilities as opposed to intellectual disabilities, they will. As a result, the school count is oftentimes going to be different than the, I guess you would call the real count. About mid-1990s, most experts estimated that the cause of intellectual disabilities was known in about 10 to 15% of the cases. All right, so that's not very much. Now, mapping the human genetic code, or the genome, has really helped identify causality, but there's still at least 50% of the cases, at least half, it's very difficult and challenging to identify a cause. All right, so we're going to get into causes here, and there's really 3 categories that we need to think about. One is called the prenatal. I'm sure you've heard of that category. One is perinatal. Prenatal is before birth, perinatal is at the time of the birth, and postnatal is after birth. So think of those 3 categories, or those 3 categories, as circles, and then we're going to talk about each one of those and how causes relate to those categories. So that first is Down syndrome, and again, there's a link there, not very long, but gives you an idea of the characteristics of Down syndrome. And again, we can look at Down syndrome on a spectrum from severe to mild. So if we take a look at prenatal and we look at Downs, some causes is that there is the 21st pair of chromosomes is, for Down syndrome, is triplet rather than a pair. So there's an issue prenatal-wise with the chromosomes. Most common genetic form of intellectual disability present at birth. Okay, so when we talk about intellectual disability, the category that's most common would be Down syndrome, and that's a result of a pair of chromosomes that is off by 1. All right, characteristics: thick folds in the corners of their eyes, slanted eyes, They slant upward. They look almost oriental. They generally are small in stature. They are, I guess you'd use the word stout. Their muscle tone is decreased. They have a small oral cavity, a small mouth, short and broad hands. So prenatal Down syndrome, they're going to look different than what you would have as your, or what you would see as a regular student. There is connections between Alzheimer's, and there is a connection between the age of the mother when she gives birth. There is the chances of having a baby that has Down syndrome is increased as the age of the mother increases. Right? So some screening methods to identify students that have Down syndrome. There's a serum screening where they can go in and take serum out to determine the chromosomes. There's amniocentesis. There's sampling, chronic villus sampling, and nuptial translucid sonogram. Though you probably have heard of sonograms. So there are where they can go in and kind of look inside mom's womb and make an assessment based on that sonogram. So there are several ways that you can test prenatal-wise a student that has Down syndrome. So my question would be, why would they want to know that information? If you were the mom, would you want to know that? If so, why? Now there's another syndrome, another prenatal syndrome called Williams syndrome. And there's a link there. Again, very interesting syndrome. I don't know if you've ever seen someone with Williams syndrome. I believe I have seen one person with this syndrome, but it's a prenatal syndrome, and if you click on that link, you'll learn about the syndrome. This is caused by absence of material in the 7th pair of chromosomes. So you're beginning to get a picture here that those students with intellectual disabilities have a issue or a problem related to heredity or related to their genetic makeup. Williams syndrome has mild to moderate intellectual disabilities, so not severe. They often have heart defects. They're very sensitive to sounds, to loud sounds. They have elfin features, so they'll have a long face, long ears, and they need strict adherence to daily routines. They desire structure. And they have tremendous storytelling abilities. And again, I think if you look at one of the clips, you'll be able to see that. They can modulate their pitch and the volume of their voice when they're telling stories. So great storytellers, which is kind of an unusual characteristic. Okay. Fragile X syndrome is another prenatal syndrome. Right. Take a look at these students. They have Fragile X. So what are some characteristics or qualities that you see physically in these individuals? So Fragile X is the most common hereditary cause of intellectual disabilities. It has mild cognitive deficits. Features include a large head, flat ears, long face, prominent forehead, large hands. So almost a combination of Downs and Williams syndrome, and occurs in more men than in women. And again, there's a link there that you can go back and learn about Fragile X. Prader-Willi syndrome. Again, look at the student or the child and see if you can identify some characteristics of someone that has Prader-Willi syndrome, prenatal. So, inherited from the father, it's a lack of genetic material in the 15th pair of chromosomes. In phase 1, when a child is first born, they're very lethargic, they have difficulty eating, but at about 1 year of age, all of a sudden they become obsessed with food and they can't stop eating. That genetic issue or problem that they have, they're not able to determine when they're full, and they continue to eat and eat and eat, and they don't have that mechanism that we have. When it says our stomach's full, it's full. They are vulnerable to obesity, drowsiness, which comes with that, sleep apnea, and scoliosis because of the weight. So this is a summary of those syndromes, and you can kind of, this I think is just sort of an organizer for you to be able to identify the syndrome and the characteristics. Now again, it's very unlikely that you're going to have a student with these syndromes in the classroom. If you do, if there is a child that has these syndromes, probably are going to be in a self-contained or a special class, depending on the severity of the disability. But I think it's important to understand that when we talk about learning disabilities, again, we're seeing this on a spectrum, and you're seeing one far end of the spectrum relative to the prenatal category. So some of the causes might be errors in metabolism of students. They have inherited deficiencies in enzymes. They could have PKU, which results in abnormal accumulation of high PKU concentrations, which result in abnormal brain development. They are screened before they leave the hospital, and diet is important. Developmental disorders of the brain formation, again, hydrocephalus, water fluid around the brain might be a prenatal cause. Microcephalus, head is small, conical in shape. Intellectual disability is severe to profound. I remember seeing a student that had this. It's very distinct when you see someone that has this type of disorder. And we know that prenatal is influenced by environmental factors such as alcohol and drugs, radiation, rubella. All of those things may contribute to intellectual disabilities. Okay. So now we move to perinatal and postnatal. Perinatal, so the time at birth might be low birth weight, perhaps a premature birth. Syphilis and herpes simplex might be a cause for birth weight issues or premature birth issues. When we look at postnatal causes, again, after birth, it could be traumatic brain injury. It could be meningitis, which can affect the brain, and encephalitis, which could be inflammation of the brain. So all of those things could occur after birth. We also know that there are some psychosocial postnatal causes that go beyond the traumatic brain injury, meningitis, encephalitis, and those can be abuse, neglect, lack of stimulation in intellectual abilities. That should be abilities as opposed to disabilities. You probably have heard students that have been locked in closets, or children that have been locked in closets, or have had very little stimulation from their parents. Again, those can also cause problems and issues. Again, traumatic brain injury is related to problems in various areas of the brain. And again, that temporal lobe, that left temporal lobe, becomes a very important part of ability to be able to process intellectually. Okay, so again, if we were going to organize or categorize this information, there's a chart there that summarizes the causes of prenatal, perinatal, and postnatal. Okay, I'm going to stop there, and we will do the second part. Again, we're in Chapter 5, so we're going to complete Part 1, and we'll do Part 2 next.